Alright guys, this is Health Nibble number 86, or maybe it's 85, I can't remember. But if I put that wrong in the description, I'll definitely correct it. So Aaron and I spent the weekend basically in Ogden, Utah at a seminar with a lot of the top functional medicine doctors in the country, and it was awesome. But there was this guy. So I'm on my way back from hockey, and I had to fill in for another team, so I just played 4 hours of hockey, and I think I'm too old for that. My knees feel like they hurt to hit the gas pedal. So anyway, that kind of stinks, but I am 41. But anyway, so it made me think about like this blood sugar stuff, and I supplemented my brother's keto shot with exogenous ketones. I kind of wanted to test my blood and see how that looked, am I in ketosis, am I not? But anyway, all this stuff made me think about the lecture this weekend. I think it would be a good health nibble. And, coming up here, I'm going to pull some stuff out of Dr. Don Klum's lecture. But the one thing that was so interesting to me is back to this diabetes thing. And the majority of America is in a diabetic state. They just don't know it yet. They have protruding bellies, the dad bod where you look at them from the side and the belly's popping out. I mean, they're in a diabetic state for sure. Females too. The liver's swollen, full of fat, pancreas full of fat. And, his point was you only need to lose 1 ounce of fat to reverse diabetes, because everybody thinks it's the liver, the pancreas that produces insulin is broken, so it's screwed up, so it's not producing insulin. It's not the case at all. The beta cells are plugged up with fat. So, and we talked about before, when you have a high sugar diet, half of that's fructose. Fructose has to be processed by the liver, and it plugs up the liver and the pancreas. Glucose will do that too. But the organs getting plugged up is what really creates this diabetic state. So how do you get it out of there? Well, you either don't put it in and or burn it out. So we talked about that. Fasting is an amazing strategy to do that, and we see that, and I mentioned this before, we see that with gastric bypass patients. They can reverse diabetes within a couple weeks because they're not eating anything. They're not eating as much. So, his little joke is in the medical world, and how, I was taught at school is, gosh, you got to lose weight to reverse diabetes. Well, you know what? Extra weight is really hard on your body, but it's not diabetes. Diabetes is a hormone issue, not a weight calorie issue. So all you really have to do is unplug those beta cells in the pancreas to get it to work again. There are cases where you can truly have an autoimmune reaction, and your pancreas doesn't work anymore. And in those situations, you become type 1 diabetic, and you need insulin. But the majority of Americans, and now the majority of people in Japan and China, it used to be we were the only disgustingly sick country, and now everybody's following suit because they're all eating our stuff. But anyway, so to reverse diabetes, if you're 100 pounds overweight, you can really change some physiology and be still really big and not diabetic. So, like, on the health path. And the other side of that is you can be really sick and you just don't express weight. So some people just don't express, their phenotype. So they're skinny no matter what, but their organs are full of fat. And so they get cancer and heart disease and all the stuff that comes along with that. So all you really have to do is lose 1 pound of fat. It just has to be the fat in the right spot, which is in the pancreas and the liver. So that's your health nibble for the day.